The skin is the largest organ of the body and is also called the third kidney. It protects the body from disease and chemicals. It also holds in fluid and helps in temperature regulation. So it's very important. According to the CDC, up to 28% of nursing home patients have some sort of skin impairment. Healthy skin and feet are critical for healthy aging. As a nurse we have an important role in the care of the skin and feet of our patients. In our paper, we'll be covering 3 different topics in relation to healthy skin and feet. The first one is health concerns and trends. The next one is nursing interventions concerning healthy skin and feet, and also alternative care options. So before we talk about those things, we're going to briefly talk about skin impairments and about feet and those types of impairments. With our patients, geriatric patients in particular, they have several risk factors that contribute to obtaining these skin impairments. Poor nutrition, poor circulation, diabetes, which also contributes to poor circulation and increased chance of skin infections, poor mobility. Also, they have reduced sense. Many patients, as they age, they have reduced sense of sensation, often associated with poor circulation and also diabetes. Incontinence. We also consider patients with trauma and post-surgical patients that have wounds, and with aging, as a patient ages, their ability to heal is impaired as well, so those wounds take longer to heal.
There are many skin problems with aging. Those who are immobilized or medically fragile are at higher risk for developing fungal infections as well as pressure ulcers, which are both major threats to wellness. Common skin problems with aging include xerosis, which is extremely dry, cracked, and itchy skin; pruritus, which is itchy skin; seborrheic keratosis, which is benign growth that appears mainly on the trunk, face, neck, scalp, and occurs in single or multiple lesions. These can be removed by a dermatologist. Herpes zoster or shingles is a viral infection. It is frequently seen in the elderly and caused by latent varicella zoster virus. Patients who have had chickenpox in the past often develop shingles as an adult or elderly patient. Cancer of the skin, including melanoma and non-melanoma, is the most common of all cancers. Cancers, most are curable except melanoma, which accounts for 5% of all cancers, and greatest risk for death. Prevention includes sunscreen, quitting smoking, limiting amount of exposure in the sun, and then frequent regular screenings. Common skin conditions of physically ill or hospitalized patients include pressure ulcers as well as fungal infections. A pressure ulcer is an injury to the skin or underlying tissue resulting from pressure or in a combination with a shear, usually over a bony prominence. Fungal infections are infections of candidiasis or yeast. Pressure ulcers, usually our intervention is to prevent the advancement of the pressure ulcer. Tissue becomes infected when it is moist or the amount of friction, and then also due to age. Fungal infections are present at any age. However, an infection can occur depending on the environment. So it usually develops in an obese, malnourished, a patient who's receiving antibiotics or corticosteroid therapy, and also patients with diabetes are at an increased risk for developing fungal infections. Treatment would include prevention, which is keeping the skin clean and dry. Common foot problems. Many foot problems occur due to poor fitting of shoes, wear and tear, and then misuse of the feet. Foot health and function may reflect systemic disease or give early clues to physical illness. Corns and calluses are bone growth or compacted skin, and it's usually due to ill-fitting shoes or stress on the foot. Bunions are deformities, usually occur due to long standing, and it's the squeezing together of the first and second toes. Treatment would include custom-made shoes, corticosteroids, inflammatory pain meds, and then also surgery. Hammer toes are permanently flexed or paw-like appearance of the toes. It's due to muscle imbalance and pressure, also caused by poor fitting shoes, and is seen often with bunions. And then fungal infections are common due to the aging foot and also increase with age. Nail fungus is also a common fungus amongst the elderly, and it is characterized by degeneration of the nail plate, as seen by change in color of the nail, brittleness, thickness, and when it involves the nail, it becomes very difficult to be healed due to the circulation to the nail. Tinea pedis is similar to Candida infection, and it is a problem developed in your foot, actually in between your toes. In order to keep it from spreading, we also need to make sure that we keep feet clean and dry. And then toenail care is also another important detail in elderly foot care.
As previously mentioned, one of the most common skin problems associated with aging is cirrhosis. This is primarily attributed to poor hydration and can be assessed by evaluation of the skin and mucous membranes, focusing especially on the turgor of the skin and the moisture of the mucous membranes. Since skin can only be hydrated with water, it is important to advise the elderly client on adequate oral water intake. In addition, superfatted soaps or skin cleansers are often preferred over deodorant soaps. This is because superfatted soaps and moisturizers are more hydrating to the skin as opposed to deodorant soaps, which are often very drying. If deodorant soaps are utilized by the elderly client, it is important to let them know only to use them in areas such as the axilla or the groin. Another nursing intervention for the prevention and treatment of cirrhosis is promotion of use of only tepid tap water for bathing. In addition, patients should be advised to avoid prolonged water baths. Sponge bathing is preferable, and daily baths and showers are often not needed in this general population. In areas of extreme dryness, petroleum jelly can be utilized and applied to the affected areas, preferably prior to bedtime. If these areas are the hands or feet, cotton gloves should be applied over the petroleum jelly, which will aid in hydration. While completing an assessment of the patient's skin, it is necessary to pay special attention to areas such as lesions. This is particularly important because of the prevalence of skin cancers in the elderly population. The ABCDE method is preferable for these evaluation techniques. First, the shape must be assessed for any asymmetry. The border should also be evaluated for irregularities. Color variation within the lesion should be identified, and the diameter of the lesion should be measured to ensure it is not over 6 millimeters. It is also prudent that the caregiver note any changes in the lesion over a long period of time. If they do not regularly take care of the client, it is important to ask the client if they themselves have noticed any changes in the lesion. If any of these evaluation methods reveals a lesion outside of the normal limits, we should definitely make sure that the patient follow up with a dermatologist. Pruritus, or itchy skin, is another common complaint among the elderly population. It could be associated with cirrhosis or a completely different complaint entirely. The nursing intervention for this is primarily promotion of the use of cold compresses or oatmeal or Epsom bath salts, both of which have been demonstrated to be effective in the setting of pruritus. As mobility generally decreases in the geriatric patient, particularly in the acute care and long-term care setting, it is prudent for the nurse to identify patients who are at high risk for skin breakdown. The gold standard for this is utilization of the Braden scale, which takes into consideration not only the mobility of the patient, but also any sensory perception, the degree to which the skin is exposed to moisture, degree of physical activity, usual food pattern intake pattern, and friction risk. Those patients identified to be at a high risk for skin breakdown should be frequently repositioned at least every 2 hours, and a pressure-reducing device such as alternating airbed, waffle overlay, and utilization of pillows to raise heels off of the bed should be used. In addition to the nursing interventions just discussed, it is also important to mention those regarding the care of feet. This includes toenail care. Patients should be educated on the proper method to cut toenails, cutting them only after a bath or a shower when they are at their softest. Toenails should be clipped straight across and even with the top of the toe. Edges can be filed slightly to remove any sharpness, but not to the point of rounding, as this can promote ingrown toenail. Patients with diabetes should be instructed to perform daily foot inspections and advised that foot care should only be provided by a podiatrist or a registered nurse with expertise in this field.
This portion is on alternative care for treatment of the skin and feet in the elderly. Whether it be because of physical or cognitive challenges, our adult patients have more difficulties when it comes to maintaining their own hygiene. Despite these challenges, it is very important that they take part in bathing. Bathing not only promotes healthy hygiene, but helps identify any issues they may not be aware of, such as ulcers, skin conditions, and breakdown, and let's just name a few. And many members of our older community may need assistance to perform these basic activities of daily living. Alternative care does not replace medical treatment, but can complement it. Therefore, bathing should be recognized as an important piece of elderly health care, and bathing on a consistent basis is crucial. Older adults should be educated not to use hot water, but warm water, as sometimes a sensory perception or disease may mislead them as to the actual temperature of the water, which can lead to injury. To expand on that, older adults should not stay in the bathtub or shower too long. Do not soak or stay in the bathtub too long or aggressively wash the skin. This can compromise the protective barrier of the skin and dehydrate the skin. Creams are preferable over soap for the same reason as our soft washcloths. Any cleansing products or creams used by the elderly that they have not used before should be used with caution. This will help avoid any reaction due to allergies and or medications that may interfere with the product. Specifically in regards to foot care, soaking feet over a short period of time in an herbal bath that will not cause any allergic reaction can help soften that skin and those toenails, which could wreak havoc down the road if left unchecked. It is very important to thoroughly dry the feet. Drying the feet will help avoid skin breakdown and fungal infections. Now, there are moisturizers that are recommended for older adults, including dimethicone. Dimethicone is a moisturizer that is popular for treating and preventing dry, rough skin and itchy skin, as well as some other minor skin irritations. If the patient cannot massage his or her own feet, it is beneficial for someone else to do so. Doing this will help promote circulation and again assess any issues that may be present that the patient may not be aware of. Toenails should be trimmed. If it is not safe to trim them by the individual, a podiatrist and those that specialize in this specific type of foot care should be consulted. Keep the feet moving with foot exercises. That's also really important. It is recommended that feet should be moved back and forth to help strengthen those muscles and promote blood circulation. Watch out for those favorite house slippers. the most comfortable house shoes can be a fall hazard and ill-fitting, and if so, they can injure feet. Instead, protect feet with shoes especially designed for that individual's needs. Whether they suffer from edema, diabetes, or neuropathy, those are just a few conditions that can really be important to have the proper footwear to maintain healthy feet. No matter what type of footwear is chosen, it is crucial, though, to check those shoes for anything that does not belong there. That can eventually lead to ulcers, breakdown, and infection. And with anything else, before beginning any type of skin or foot regime, it would greatly benefit the older adult and his or her family or caregiver to seek medical advice as to what works best to promote the best possible skin and foot care for that individual. Thank you very much.